Daily coronavirus infections have dropped to the lowest point recorded since June of last year. Hospitalizations fell almost 18% in 1 week, and average deaths hit a new low of less than 600 per day. The head of the CDC says Americans should have, quote, cautious optimism. Meanwhile, the nation is averaging between 1.5 and 2 million coronavirus shots per day. More than 37% of the population is fully vaccinated, and officials are urging children to get vaccinated as new data shows the virus is spreading among younger Americans. Manuel Bojorquez reports.
My message to young people, of course, is simple. Get vaccinated.
Tonight, the positive news on COVID comes with a plea to vaccinate, as cases in children are on the rise. Nearly a quarter of new weekly COVID-19 infections are in kids, according to the American Academy of Pediatrics. More than 600,000 children ages 12 to 15 have been vaccinated since the Pfizer vaccine was authorized for that age group last week. That still leaves more than 16 million to go.
We're nervous.
The University of Miami Health System is trying to boost the numbers, sending this mobile pediatric unit to underserved communities like the Little Haiti neighborhood to give shots to children and adults.
Now I feel safer to leave the house.
16-year-old Tatiana Pierre is the first among her friends to get one.
A lot of them want to get the vaccine, but they don't know a lot about it. So I think they're waiting for me to get mine so I can tell them about it.
Eric Green got his too.
So a matter of convenience for you.
Yes.
How important is it for you to be able to have this kind of place?
Oh, a lot. Very important. It's getting out to the community, and we need to get back to normal life.
So far in Florida, only 7% of vaccinated people are black. The White House acknowledged today the need to balance vaccine inequities.
We are making progress in equity through very intentional focus. However, in the next phase of our vaccine program, we know there is much more to do.
And tonight, there are questions about when all age groups will be eligible for the vaccine. Dr. Anthony Fauci gave this timeline.
It is likely that by the time we get to the end of this calendar year and the first quarter of 2022, that we will have enough information to be able to vaccinate children of any age.
While some states are holding on to their mask mandates, some people here in Florida who were accused of violating local COVID restrictions are finding that their criminal cases have been dropped. And in Texas, the governor announced that they will not allow any government entity, including schools, to require masks, or they could face a $1,000 fine. Elaine?
Manuel Bojorquez, thank you. Dr. Payal Patel joins me now. She's an infectious diseases physician at the University of Michigan Medical School. Good to see you again, doctor. So White House senior advisor Andy Slavitt shared that his son is battling long-term COVID. His symptoms include tachycardia, shortness of breath, and frequent flu-like symptoms. How common is this in younger populations, and does this make efforts to vaccinate younger people more urgent?
Yeah, I think when you're thinking about immunity and you're thinking about, kids can just get COVID and they may not have to get hospitalized, you have to consider that we still are learning about the symptoms of what can happen after COVID infection. We know it's clean and safe to get the vaccine. All of us old people have gotten vaccinated and most of us are doing just fine. That's what we want for young people as well. So I think that parents should think about that as they consider getting their kids vaccinated. It's one and done, and no symptoms afterwards, compared to still learning how long, months, years it could be with getting an infection as a kid.
Right, and tachycardia, I should have mentioned, as I understand it, doctor, is where you have an increased heart rate, really high. Is that correct, doctor?
Yeah, that's right. Different people who've had some of these symptoms say that they feel imbalanced in their ears. They feel extremely tired, extremely fatigued. You can imagine how much that could impact you when you're a young person.
Absolutely. Well, a CDC report found that vaccinations lagged in rural America through April of this year, and the agency says these disparities could, quote, hinder efforts to reduce COVID mortality and morbidity. What are the biggest contributing factors to this slow vaccine uptake?
You know, it's complicated. There's a couple of things going on. One is, in general, in rural America, it's a little bit harder to get to a vaccine. People may have a harder time taking off or finding the vaccine itself. And there's also some more vaccine hesitancy in these areas. Today, we heard from the White House that they're really thinking about it on a zip code to zip code basis. We know that where you're born in America, in that zip code can mean a different life expectancy, just at baseline. Those same factors are coming in now with COVID-19. We know that if you're in a rural part of America, you may have a harder time getting to the hospital in time. You may end up sicker. So these are actually populations that really do need to get vaccinated. The CDC is working right now with local public health authorities and people in these communities that the citizens actually really trust, whether that's a religious leader, whether that's their primary care doctor. I think it's going to be a ground game trying to get some of these communities vaccinated.
Well, taking a look globally, the Biden administration has promised 80 million coronavirus vaccine doses to other nations. But experts say this isn't enough, and struggling nations are turning to other world powers for help. Doctor, do you believe the U.S. can and needs to be doing more on the global scale?
You know, yeah, it's a great question. And I think one thing to remember is here in the U.S., we are very lucky. At the end of this, we're not going to only have enough vaccine for every person in America to get vaccinated, but double that. Everyone in America could get vaccinated. We're going to have all of these extra vaccines. So what do? We look in the news and we see what's going on in Brazil and India. We need to get the vaccine out to these vulnerable populations to help relieve the healthcare system, help save lives. And I think that our government is doing that. We are going to have to work with other countries who also have an excess of vaccine, as well as countries who are developing their own vaccine like India in a number of different ways to really increase vaccine uptake and quickly.
Meanwhile, the director of the Oxford Vaccine Group says it's, quote, morally wrong for wealthier nations to vaccinate children before poorer countries can vaccinate at-risk populations. What's your take on that, Doctor?
I read that article today. You know, I think it's difficult to say. We're seeing right now in Brazil that unfortunately a lot of children, same in India, are also getting very, very sick. So I think that it makes sense that every country is going to have a different vaccination plan. And of course, every country is concerned about their own citizens. I think that makes sense. But at the end of the day, we can't stop there. We have to make sure that we're thinking about this as a global game. And that's really the important thing at the end of the day.
Dr. Payal Patel, always good to have your insight. Thank you very much.
Thank you so much.